masturbation is the number one question that you ask.
Masturbation is my favourite subject, I have to say. In fact, I think I should go on not questions time, what's the other one? Mastermind. I'll tell you why. I think it's one of the things, it's something that very few people talk about. And I think it's one that hardly any clinicians ask about. And I think if you're seeing particularly men, I mean I do ask women, but if you're seeing men with sexual problems, for example, erectile dysfunction, premature ejaculation or delayed ejaculation, I think you need to ask. And I think asking early in the assessment can either identify whether masturbatory frequency and technique is a cause of the problem, or if it's not, you can then move on to finding out what is. So I think asking it first allows you to identify what might be the issue, but it also allows you then to focus on other things if it isn't an issue. And I think it's really interesting because back in, I think it's 1994, a guy called Michael Perlman, who's an American, I don't know if he's a doctor or professor, but he talked about high frequency masturbation and technique can provide a wealth of diagnostic information. And that was back in 1994. And that's before, you know, accessibility of pornography has escalated to the degree to which it has.
What do you mean by high frequency?
Well, somebody said to me, well, you know, what is too much? Well, it depends on the man. You know, and maybe a man can masturbate very, very regularly and it not cause an issue. However, if they're having experiencing a sexual problem, it may be the frequency of masturbation may be a contributory factor. So, for example, if they're masturbating daily or 3 times a day or even more, I've definitely heard even more than that, and yet they're struggling with a partner, it might be that that habit is a cause of the sexual problem with a partner.
And this is more common nowadays because of porn?
Yeah, definitely. And not just porn, I mean, everybody focuses on porn, but what's available online as well is chat rooms. So sexually explicit chat with somebody, I mean, there's some of the people I see, their issue is not so much viewing pornographic images, it's sexually chatting with somebody they don't know, that then might go on to, you know, FaceTime and doing things online with somebody they've only met via a chat room. So it's not even just porn.
But they're all doing this at the same time, because presumably they're in the clinic because they're in relationships, or not necessarily?
They may be in relationships, they may not be. So basically they've gone to their GP saying they've got a problem, and the GP has either referred them to us in this area or to urology. If they go to urology, the chances are they might well be referred here, because if they exclude anything organic.
By which you mean some medical problem?
Yeah, so for example, if you were talking about problems with ejaculation, you know, you'd maybe want to check their thyroid, you might want to make sure their testosterone was fine, those sorts of things. If they have diabetes, that could be an issue related to that. So you'd need to exclude that. But if any of those factors weren't the case, then the chances are they'll be sent here. It's not necessarily, it could be psychological or psychosexual, or it could be to do just with their behaviour pattern. So I always ask about behaviour really early on, because that can give you lots of clues. And if it's not relevant, then at least you can put that one to side and focus on what might be.
And how often is it relevant?
In my experience, if there's no there's no disease, but even if there is disease, I still ask the question. But in young men where there's no disease, it's very common. It's very common that something to do with their masturbatory habit or technique has got a part to play in why they're experiencing difficulty.
And what sort of things happen?
Sorry?
What sort of things happen?
Well, there's problems with erection, so they find it hard to get sexually aroused with a partner. Either they've run out of steam because they've been masturbating too much, or they've watched so much porn they've conditioned themselves only to respond to that high level of arousing material with a very firm grip that might not be replicated during partner sex. They might find an intimate relationship or a close relationship with somebody that they care about. They might find that not sexually arousing enough because of what their body's got conditioned to get used to.
How long does it take to get to that stage?
I don't know. I mean, I've looked. There's a website called Your Brain on Porn, and what they say on there, and I don't know where they've come to those conclusions, but they say on there that if you've got a man that's older, basically he knows what ordinary normal is, if you know what I mean. So, and then if he's having an issue with porn and heavy, high frequency masturbation, when he stops, the chance that's going to be quicker for him to get back to normal functioning. But the younger a man is, when he starts watching hardcore pornography frequently, the more difficult it's going to become, because that's what he's conditioned his body to get used to, and there's nothing else to judge it against.
And is it his body that's being conditioned, or his mind?
Both.
Uh-huh.
I think it's both psychological and physical. And both that website and the one about NoFap, which is an American website.
NoFap?
NoFap. So FAP is an American term for masturbation.
F-A-P-P?
I think just F-A-P, I think. Yeah. And both of them will talk about rebooting your system. So that is where you stop masturbating, stop using porn. I think they suggest 90 days to try and get some semblance of normal arousal. Because the men who are using porn frequently are not listening to what their body needs. So it's not like they're getting erections and feeling that desire. They're constantly triggering their desire with what they're watching. So
they're not going looking for it because they're aroused. They're going looking for it and becoming aroused.
that would be my impression. And the more you look and the more aroused you are, it becomes like an itch you can't scratch, because there's not a lot of satisfaction, because you're constantly looking for the next thing, the next,
And
the
does that
next
mean that
fix,
they're
if you
always
like.
dissatisfied with relationships then, as well as sexual?
I don't know about everyone, because I can only talk about what we see here. I certainly think for some men, it's difficult to have normal sex. Just because they've got so used to sex being this highly charged sort of performance that's very, highly stimulating material, that anything sort of more loving, relaxed, I think some men find it difficult.
It just doesn't do it for them.
Mm.
And what's the impact of this on women?
Well, I suppose if you're with somebody that you care about and they can't get aroused by you, or not, they don't get aroused when they're with you, then that can make you feel like there's something wrong with you, like your partner doesn't fancy you. And then that, for the woman, can have an impact on her confidence. And then it can lead to, arguments and relationship distress that then sort of just perpetuates the problem. I think the other thing it can do is, if you get a man that can get an erection, but he can't orgasm and ejaculate, then it could be going on for ever, and likely to become quite uncomfortable, which can lead to issues with pain. And how do you stay aroused for, an hour of thrusting? I mean, it's quite difficult. I would imagine most people are quite sore.
And is that one of the problems that you see here when couples come in, that the woman's sore, and so...
Well, certainly if a woman's complaining of pain, I'd want to know how long intercourse lasts, just to make sure I'm not missing that as being the reason. So, we were talking about, if you think about young people now, what they're viewing is hardcore pornography. It's not any sort of build-up. There's nothing online about women's sexual arousal. The women are just ready. Now, women can be very easily aroused, particularly when something's new and particularly when we're young, but that often doesn't last as a relationship progresses. You need to have more build-up. Whereas if you look at porn, there's the woman is already aroused before it starts.
So young men just don't understand that concept.
I can't talk about all young men, I can tell, but I do think if that is educating young people, they're going to think that is normal. They're going to think it's normal that a woman should be just ready.
And for hours.
And for hours. I mean, I'd be asleep. And we were talking earlier about, there used to be, if you ever got hot, the first exposure I ever had to anything pornographic was my friend's magazine, her father's magazine. But the centrefold, you never saw an erection. The centrefold was a naked woman, but he had pubic hair, so you didn't really see very much. Well, that's very different to what they're seeing now. Very different. So there's no build-up, is there? There's no, we learn gradually. A little bit here, a little bit there, a bit of a, torn out page of a magazine when you went on your cross-country run from school, or a friend's magazine, or your boyfriend and what you did, whereas There's no build-up.
They go straight in their early teens to stuff that's really quite disturbing in some cases.
I think it can be, and I think, you know, a lot of young women will try and please young men, especially if they really like them.
Yeah.
So there's a lot of acting out and being what you think the other person wants you to be, which is not always about your own pleasure.
Yeah.
I mean, it was like we were talking about, you know, for a lot of women, that's why 50 Shades of Grey did so well. You know, women like build-up. And I know there's not necessarily there's a lot of sex in there, but it was a book, it was a story. Whereas porn is straight in there, and 30 seconds you're at it.
So there's no build-up, but there's an hour's worth of action of
Yeah.
thrusting. It's the wrong way round.
Yeah, and if you ever saw any sort of film when I was young, or in my 20s, you know, there'd be a storyline to it. They'd have shoulder pads and a curly perm. And, you know, if they it would be about the plumber or the man doing your roof, and at least you'd make a phone call on one of those old phones, and you'd speak to him on the phone, and then at least he'd pretend to have a tool, you know, he'd have a toolbox, and make some pretense of, you know, fixing your washing machine before you told him you couldn't pay. So there was quite a lot to build up to.
There was the start of a relationship, potentially.
Even if a very quick one, it's a lot quicker now. But I think for women, a lot of the time, that sort of build-up is important, because you're saving the, if you like, the most explicit bit until you've already got aroused.
And how often is that played out, do you think? Oh, I don't know if you see this here, but, you know, those kind of sexual encounters in real life, are women just, because expectations have been altered by porn, not just for men, but for women too.
I mean, I'm not, you know, I don't, when I've been on some lectures by people who work internationally in the field of sort of sexual therapy and sexual medicine, you know, a lot of the research that they present is that a lot of, you know, that younger women are less likely to have orgasms, that women are likely to, you know, in early sexual relationships. I can't remember who did the presentation that I saw, but she was part of like an international circuit of speakers, and she was talking about, you know, young men and young women, and actually a lot of young women have sex to please the man, and they have the sort of sex the man thinks they should have.
So they're not even thinking about their own pleasure,
No.
let alone asking and
That's what she was
training their man to
saying.
give them what they want.
Because how do you know what you want if you've never experienced it? You know, if you're only evidence of what you should.
Or seen it. So, what's the solution? So if you've got a couple, so you ban them from masturbation.
Well, I think it's about, you know, it's there's nothing wrong with masturbation as such, unless for cultural or religious reasons there is. It's just being aware that actually doing things too much, too many times, might make it not as satisfying. You might actually get better sensation and pleasure if you do things a bit less and have a bit of build-up and a bit of anticipation of something, rather than, you know, everything's got to be now straight away. You know, if anything's wonderful, if you do it every day, is it going to be as wonderful? Whereas if you sometimes wait a bit with things and let them build up and listen to your body more, I think. Does your body need it, or are you triggering it psychologically? And I also think the other thing with masturbation, it's always, you know, what does a man use it for? Some of them say, I can't go to sleep without doing it. Or they do it when they're distressed, so it could be a stress relief.
But not 3 times a day.
Not unless you've got a job. If you're at home, boredom is another one. It's there and it's accessible. You don't need to go to a computer in the living room or the kitchen. You just got it on your phone. So it's like, well, that's what I do. So some of it can just be habitual, not even thinking about it. But
so do you get young couples coming in who you literally have to say, you know, this is how it works. You need to spend 5 minutes. You need to explain foreplay.
sometimes, yeah. Or not even foreplay. Before foreplay is more important.
It's that thing where, you know, sex starts at breakfast.
Yeah. And one long move throughout the day and you've had it. That's usually when you've been married for a while. But just the context, you know. So they spend the evening where he's on his iPad and she's watching the TV, and they go to bed and expect it all to work. Which it might do for some, and it might do in the early days, and it might do for men, but sometimes women need much more. Then you need to think about the context. Do you feel connected? Have you been laughing that night? Have you been sharing something together where things just then are more likely to evolve, or are just expecting everything to work without any effort. I mean, usually I think the longer you're together, the more effort you need to make, and the more it's about technique.
And learning the techniques together.
Sorry?
Learning techniques
Yeah.
together, yeah.
But it's hard to learn when you think that's how it should be, because you've seen it somewhere. You've seen it on the internet and that's how it should be. Well, the chances are there are going to be a lot of disappointed people. Because I'm not saying it can't be like that sometimes for some people, but the chances of that being the way it's going to be throughout your life.
Mm-hmm. So actually, the messages for men as much as for women, there's two messages really. For men, you can actually make your sex life better by masturbating less frequently.
Yeah.
And for women, it's about what do you want?
Yeah.
Because that's the worry, is that young women just don't.
Well, young women decide what they want is usually decided by their partner. Because they tell them what they should be doing and how they should feel, and they should have an orgasm. And they should be able to have an orgasm without any clitoral stimulation. You have to learn.
So where can people learn? Where can young couples live? I mean, if this is largely a young person's problem.
I think young people are going to be more at risk because they use technology much more regularly. I think there's older men that have a problem because of this, but I suppose the young are more at risk because they grew up with, social media and all the technology, and it's normal for them to be looking for things. But you can, there's all sorts online to do with, learning more about how your body works and just fun. I mean, Tracy Cox. I mean, she. I'm always recommending people buy her book, Hot Sex, which has been out for years, but it's a really good at some basic anatomy, difference between men and women, similarities. It's a really good basic book to help people get to know, I suppose, a little bit more about themselves and their partner. And we're not all one big homogenous group that should be turned on by the same thing. I also think, going on YouTube and finding things about sensual massage or sensual touch, or if that's what you want, playing games. You can get card games with all sorts of different suggestions, and there's something about that for some couples. It gives you ideas that you might not have tried. Because when your partner says, well, what do you want to do, and you don't know, it just becomes a conversation with no end. Whereas if you say, okay, well, let's play a game. Let's try these things. There might be things we find we like and things we find we don't like. So you've got to almost be exposed to things to know whether you like them or not.
Be exposed to more than
just available on porn.
What is sort of regarded as normal now?
Yeah.
Is it regarded as normal?
I think so. That would be my impression. I think the only thing is a lot of young people now, I think probably what really helps is they've got friendship groups. A lot of the young people I know, they've got friendship groups. And I think having a mixture of male and female friends is probably a really good thing.
If they can talk openly.
Yeah. Because I remember, when I was at school, you didn't really mix. The girls, girls and boys didn't really mix. I think it was having friendship groups, and that seems to be quite a regular thing. I think that's probably quite good because you do get to know the opposite sex within a different context, where they're your friends rather than being a potential.
Which is fine, and I think that works for relationships. But if there isn't an alternative point of view being presented, if young women are doing what pleases men, and there isn't an alternative voice saying, well, hang on, how is it even coming into those conversations? So resources for young women would be really useful. Yeah, well, there's a website called The Dirty Normal, and that's actually done by a young woman, and that's a really good website for young women to have a look at. Okay. They present quite a bit on research. I don't know whether she's a PhD student, but she's really has seems to have her finger on the pulse of what's going on, and lots of because that's what young women want. A lot of people use social media, so you want to be going on websites that actually give you really good information. And I think one of my patients told me about that, The Dirty Normal. And I've looked on it, and it's really good. Mm-hmm. So it challenges lots of things, and also gives you the backup evidence. And what sorts of psychosexual problems does masturbation and porn, what do they create within relationships?
Well, I think you've got the specific dysfunctions that we've talked about that then are going to have a negative impact on relationships. I think some people also, I've seen, where they avoid being intimate with their partner because they'd rather go and just have sex by themselves because they enjoy it more, it's easier, they don't have to think about feelings. So that becomes their norm, and then that can be really, really distressing. I think for younger people it can also, I think it's also worth, you know, depending on how young you are when you view it, I think for some young people it could be traumatic. You know, you might have gone from no knowledge, no information, to seeing that.
Like a grenade going off in your head.
I mean, I remember one woman who came from she'd had an arranged marriage, and so was, you know, naive about anything sexually or sexual or intimacy based. And so when they got married and intercourse wasn't possible, potentially because of something like vaginismus, her partner showed her hardcore pornography, which rather than making her think, yes, I can do that, absolutely terrified her. So I think, you know...
How did you get around that couple?
I think eventually, I can't, my colleague worked with her, I think eventually we had to talk about it quite a lot because she almost had a sort of post-traumatic stress response to it. So she was frightened anyway, and then to see that was really quite destructive. I think eventually things settled down, but I think that took an awful long time for because her partner wouldn't come with her either. So it was a long process in that particular instance. So I think it's that. I think there's some young men who feel inadequate by what they see and are scared to do anything because what they've seen is actually, you know, some sort of marathon performance, and that can cause feelings of, you know, anxiety, if you like, that's what's expected.
But equally, actually, you know, they feel really good about themselves if they are lasting for an hour, completely unaware of the fact that the woman's going, oh,
yeah, I know.
It's over yet.
I know. I mean, an hour. You know, an hour with other things maybe when you're young and got loads of time and energy, but just thrusting. But I do think as well some men seem to believe they can keep going, that's what the woman wants.
A form of machismo. So how would a woman be able to tell if the problems are related to porn? If she's just having a relationship problem, what would be the signs?
If you had a problem with porn?
If the relationship problem was related to porn and masturbation?
Well, I suppose if everything was fine between them, then whatever he was doing with masturbation and porn potentially wouldn't be an issue. But if he's avoiding, I mean, the biggest thing people do when they've got issues, they start to avoid things. So is he avoiding you? You know, and it might not be anything to do with porn and masturbation. That might be, you just don't know really. But the classic signs would be avoidance of things, stopping kissing, cuddling. If you approach someone, they pull away. I mean, those are classic signs of somebody that's not relaxed and somebody that's obviously worried. But what you don't know is what they're worried about. He could just be worried because, I don't know, 2 weeks ago when he had sex, it didn't work. It might be completely unrelated to pornography.
Or in sex.
Or in sex, yeah. But I think certainly seeing somebody who can't put their phone down all the time, there's obviously got an issue with the phone, but what that issue is, you would need to check out. You know, if they're disappearing, if they're locked in the bathroom, it'd be those sorts of things, really. But you won't, that could be signs of all sorts of things, couldn't it? Because
You begin to build up a picture.
You begin to build up a picture, isn't it? And it's like lots of little clues, isn't it, that you start to notice.
And how would you address it?
Well, I think most people, when they, if you do hit the nail on the head and that is the issue, the chances are they're going to deny it. So it depends. I suppose it depends on the individual about whether you're used to talking and listening to each other, or whether when somebody's guilty about something, they often go into denial and just start avoiding it even more and denying it. So you're going to have to keep trying, aren't you, to have a conversation about it.
But in a non-confrontational way. Is there anything she should avoid saying? Is there other trigger?
Well,
trigger
in the theory, you're not supposed to blame. Because if you blame somebody, the other person then becomes defensive. But to be honest, that's the theory. And sometimes when you're very, very upset, and especially if you feel quite rejected, the chances are there's probably going to be it's if you're really upset, it's very hard to stay calm. But if you're not calm, it's very difficult to talk. So if that's too much, I'd probably write something down. If I was struggling to vocalise how I felt because I was so upset, I'd probably write something down and see if I could get them to read it rather than it. Because while you're angry, if you're both angry, you're not listening. And to try and sort something out, and you have to talk. But that's what most people find most difficult to do when they're upset.
And if they get to a point where they're saying, okay, there's, I'm masturbating too much, I'm watching too much porn, does just stopping for, can you put limits on it?
I think it varies. It's just like, it's like people, maybe you like a drink. Some people can cut down, some people have to stop altogether. I think if your relationship is, if you need to talk about things and you can't do it between the two of you, the one place you could go is relate, where you've got some time and space and somebody to actually mediate. So I think that is really important. And and relate have centres all over the UK, so I think that's really important. I think if you've got a problem with pornography and masturbation, and I would encourage them to go on the NoFap, because you can actually get a NoFap app. So you can actually get an app for your phone that helps you try and control your masturbatory and porn habit. I think understanding whether that might be an issue, I think is the first step. So I think looking at one of those websites, it starts to make sense. I think if somebody does have a problem and they class it as maybe a compulsion or an addiction and they feel they can't stop, there are websites out there, but specific treatment generally is private. But you can go. There are therapists trained who've done a specific training to work with sexual addiction or sexual compulsion.
But at least if you get to the point where you're talking about it, then you can work together.
You would hope so, but my experience is a lot of women in that situation, if they've felt very, very hurt and rejected over a long period of time, it's sometimes quite difficult to work with somebody with it, because you feel betrayed, you can feel hurt, you can feel rejected. Sometimes it's really difficult, depending on how long the problem's gone on for and what it's involved, because it might not just be pornography, it could be chat rooms, it could be escorts. It depends very much on the scenario, and certainly some of the therapists that are specifically trained to work with this in this particular area, some of them also can help partners, because sometimes partners need help individually to come to terms with things themselves. So sometimes just because the man might confess doesn't mean the woman's in the right place to help him, because she's got all her own feelings and the impact it's had on her. So sometimes it's quite difficult.
Can watching porn, can it affect women in the same way as it does men? Can they be?
I haven't seen very many women. I'm sure it can. Anecdotally, I've seen one or two. Anecdotally, I've heard about women who maybe go out for to meet men for casual encounters, that they can't feel they've got into that cycle, and they put themselves in quite dangerous positions because they're hooked on the unknown or the danger. Certainly anecdotally I've heard of that. Here I've heard of, I've seen a couple of young women who found it difficult to have relationships and who were exposed to pornography really early on. I mean in childhood.
But not the same thing as a man becoming desensitized, that in fact oversensitized.
I think that the one woman I'm thinking about, she wanted highly arousing stimulus, so I suppose that's similar in a way. And therefore in a relationship she couldn't have normal sex because it wasn't this exciting overstimulation that she'd been
So it's that idea that was introduced too early as normal.
Yeah.
This is what it is.
Yeah. And so therefore it's like saying I've got a problem with low libido, when actually it's not so much low libido, you've just got no experience of what I suppose a different sort of normal is. I remember Alan Riley speaking years ago, Professor Alan Riley, and he said sex should be so sometimes it's boring. Sometimes it's exciting, sometimes it's loving, sometimes it's explicit, sometimes it's routine. You know, and he was sort of saying sex is all of those things. Whereas now we seem to be in a society that wants it all to be one thing, exciting and explicit all of the time.
So realistic expectations.
Yeah. So I think unrealistic expectations is a huge problem.
Mm. So what should we be telling our daughters and our sons? Our young people, what's our advice?
What do you think it should be?
So some of the websites that you've mentioned sound as if they're really useful and informative, but somehow we need to get the discussion about this is just, porn is just one way of looking at sex.
Yeah.
And
because you can't dismiss it, because it's part of the culture, isn't it? And it's part of their reality.
But what we need to be aware of that it is only one.
Yeah, and to be honest, I think there are some groups of young people who can make the distinction themselves.
Yes,
You know,
and that's encouraging.
Yeah, and they can
the
make
pendulum
that.
swings, and you know, and we are becoming better at talking about things, and so probably in schools, the discussion is becoming, which is great. In 5 years' time, perhaps we won't be having this conversation.
Yeah. I think schools have an important part to play, but you know, the schools, it's difficult because it can't just be schools. It can't just be schools' responsibility because they have enough responsibility with all other areas.
Well,
and to be honest,
given responsibility for a lot of parental role now, haven't they?
Yeah.
Really.
And in reality, you know, if you're a young person listening to your teacher, if your teacher tells you something isn't right, are you really going to listen? You know, your online life and what you see online is far more powerful. I do think, I mean, you know, some good websites and some good places that they can go and look online.
To hear a different point of view.
To hear a different point of view. And it's always a bit more powerful if it's young people themselves talking about it rather than somebody of my age, where they just sort of, you know, you don't understand, or this is the way it is. Do you know what I mean? I think there is that. And I would have, and to be honest, if I was, you know, 18, I would have probably thought exactly the same.
Well, it's just an excuse to dismiss it, isn't it?
Yeah.
It's not relevant, you don't understand.
I mean, I remember being at the train station in Harrogate, it must be about a year ago, and there was a group of young women talking very loudly about anal sex. And it was like they wanted to shock, like we couldn't have possibly ever heard of it. But it was just that sort of, I don't know, it's an attitude that, I don't know, I found that
it's
a bit...
bravado.
Yeah.
But also it's attention seeking.
Yeah.
And it's ultimately looking for approval.
Yeah. But by your peers.
Yeah.
By your peers.
Yeah.
And so there's an element of all that, isn't there?
I do this, therefore I'm excited.
Yeah.
I'm cool.
Yeah.
It's the same peer pressure problems all the time, it's just more extreme sexual behaviour.
But I think, you know, they did, I mean, years and years ago, I worked in schools and they had a lot of peer education. I'm presuming that still goes on. But I do think you need to have other viewpoints about things.
Mm-hmm. So that's the central message, is go looking for other viewpoints. And, you know, go look, can't stop people who look at porn, go look at porn if you want, but, you know, there are other approaches which are relevant and will make you happier in the end, to be more balanced.